Hello, and welcome to today's webinar hosted by the American Academy of Pediatrics on giving medicine to kids, dosing, droppers, and other do's and don'ts. We're so glad you've joined us today. We do have a few pieces of housekeeping before we begin. The audio for today's event will come through your computer speakers, so be sure they are turned on and your volume turned up. And we will have time at the end of the webinar for a question and answer session. To ask a question, please use the chat feature, which is located on the bottom left-hand corner of your screen. You can send in your questions at any time. I would now like to introduce our host, Dr. David Hill. Dr. Hill is the Associate Medical Director of Kids Care Pediatrics in Wilmington, North Carolina, and Adjunct Assistant Professor of Pediatrics at UNC Medical School. He serves on the board of the North Carolina Pediatric Society and is chair of the American Academy of Pediatrics Council on Communications and Media. Dr. Hill won the Independent Book Publishers Association Benjamin Franklin Award in 2013 for his book, Dad to Dad, Parenting Like a Pro, which is an excellent book. We highly recommend you read that. He serves as a consultant on child care issues for local and national radio, television, and internet-based media, and he lives in Wilmington, North Carolina with his wife, 3 children, and 2 stepchildren. Welcome, Dr. Hill.
Thank you so much. I am really happy to be here. We're going to be talking, I hope, about medication safety. Otherwise, I've stumbled into the wrong conference room. So, why do we want to talk about medication safety? Well, we deal with this a lot in our practice. We use medicines a lot, and when we're using them well, hopefully they do good things. But anything that we use as a medicine has potential toxic effects as well. Even vitamins, things that you think of as relatively harmless, or over-the-counter medicines. So we want to talk about how to use these medicines and store these medicines in ways that we get the good parts and we're not so scared about the bad parts. So we're going to go through some basic drug facts to start off. So you see that because it says, know your drug facts. This child, by the way, was not allowed to play with actual medications when we did this, we took this picture. So, things to know about medicines. First of all, they fall into 2 categories. One, you've got prescription medications, and as you might imagine, you got to go to a doctor, get a prescription, take it to a pharmacy, and that's how you get the medicine. There are, however, a whole bunch of medicines that you can walk right into the pharmacy, pull off the shelf, take home, and give any way you want to, although that's not necessarily a wise thing to do. These are called over-the-counter medicines. I guess you used to actually go over a counter to get them, and now they're on giant shelves. We should call them giant shelf medicines instead at this point, I think. So you can get these without a prescription. They're easy. There are some things to know about these because they come in a couple of categories. And funny thing about over-the-counter medicines, when you go to the store, you're literally looking at hundreds and hundreds of these things, maybe thousands. But really, a lot of them overlap. A lot of them are the same thing in different bottles, different dosages, different brands. So it helps to know what you're looking at when you're looking at these medicines. So one is an antihistamine. Antihistamines, many of them are over-the-counter, most of them are over-the-counter. And they're for allergies, usually runny nose, itchy eyes, sneezing. If you get a bug bite or hives or other types of allergic reactions, they can also be really helpful. You'll usually see these things in bold letters on your over-the-counter prescription box or bottle that you buy. It'll say antihistamine, and then in smaller letters, it'll tell you which one you got. Aspirin. Aspirin, there is a bottle that you can buy that says children's aspirin. It is, ironically enough, never for children. There are very rare cases of conditions, certain heart conditions, where children might be prescribed an aspirin by their cardiologist to thin their blood for their heart. But unless a cardiologist has told you that your child needs aspirin for his or her heart, aspirin is not for kids. That's because it can cause a serious, even life-threatening disease called Reye syndrome that we discovered in the late 1970s. I remember taking children's aspirin as a child. It had this lovely orange flavor, but never for your kids these days. Can't do it. Cough medicines come in a couple of different flavors. One is supposed to loosen The mucus in the child's airway, that's usually, some Mucinex is the best known, guaifenesin is the generic name of this. Another is dextromethorphan that is supposed to keep children from coughing. These are all interesting ideas, but there's not a lot of evidence that either of these medicines actually do the thing that we buy them to do. And we're going to talk about that in a little more detail as we go along. Cold medicines are often combinations, so they will contain all the things that we're talking about in the top section of this slide in some combination usually. Some of them are also homeopathic, but there's some concerns around those as well. Decongestants are designed to, in a liquid or pill form, designed to decrease swelling inside the child's airway, inside the nose. It's also not clear that they really work to do that very well, and decongestants can cause problems with the heart and blood pressure, especially in younger children. You can get decongestants as nose drops, which work right where they land in the inside of the nose to decongest the airway as well. Those tend to work pretty well, but if you use them for more than a couple of days, it's really hard to stop using them because you get what we call a rebound effect. It comes back worse than it was before, so we're cautious in using these nose drops. Hydrocortisone or cortisone cream, this is a mild form of a steroid. We usually use it for itching, rashes, insect bites, poison ivy, eczema, and the over-the-counter version of this tends to be pretty safe, although it's not as powerful as some prescription versions of the same thing. Pain and fever medicines are, well, of course, for pain and fever. They come in two general categories, and we're going to talk about those soon. Saltwater drops, I love some saltwater drops. They are fantastic for loosening mucus, for decreasing congestion, especially in babies' noses, especially if they have a cold and they're trying to eat. Very helpful if they're trying to sleep. You can actually make them at home. You don't have to buy them in a pharmacy. But these are great. I recommend them all the time. And finally, there are many different kinds of stomach medicines. Some are antacids. Some, like Tums or Maalox, work right where they land in the stomach to neutralize the acid. Some, like Zantac or Pepcid, work to decrease acid production in the stomach, actually by being a funny form of antihistamine, H2 blockers. And some, like Protonix or Omeprazole, Prilosec, work in a different way to decrease stomach acid by making it harder for stomach cells to actually secrete acid molecules into the inside of the stomach. So those are your basic categories, and most of what you're going to see at your local pharmacy, those hundreds and hundreds of bottles, have some combination of these things in them. It's kind of amazing. So, things to know next. Up and away. This, an old song from the 1970s, if anybody remembers this, beautiful song about a balloon, but this is also a really good way to store medicines. If you have kids in the house, you want them out of the way. The kids, we like to say, are the fast and the curious, right? They don't drive fast cars and get in fights with people. Instead, they run around and they get into stuff. They want to see everything. They want to touch everything. They want to know what it tastes like, what it looks like, and they are lightning quick. If you've had a child in your house, you know this, right? They're moving. So you want to store your medicines up and away from these fast and curious kids. Even if you have a drawer where you keep your toothbrush, toothpaste, deodorant, whatever, that's probably not far enough away. You really want, ideally, a locked medicine cabinet, maybe a box on top of the refrigerator if your child can't get to the top of the refrigerator yet. Keep your medicines in the original containers so you know what they were. Those containers will have, in addition, lot numbers on them, which is useful if there's a recall. They're going to have dates on them so that you know when the medicine's no longer at its full potency. They also have child-resistant caps on them. Big joke, right? Everybody's heard this one. Child-proof caps, they're only adult-proof. My kid can get into them fine. It's true that they're child-resistant. They're not proof. So you still don't want to just rely on the cap to that medicine and say, I'm going to leave it out where the kid can get to it. They'll never get into that cap. Oh, no. They can probably get into that cap given enough time. So remember, you're the first line of defense. That cap is just the second line of defense. at someone else's house. This is important. You think, okay, I got my own house, great, this is wonderful. Now I'm going to go over for a play date. I'm going to visit the grandparents. We're going to go to somewhere that I'm no longer in control of the medicines. This is something you want to be thinking about, especially if you're going to spend the night there, spend a lot of time there. You say, hey, I'm bringing my toddler, I'm bringing my young child. Where, I don't mean to be nosy, but do you have any medicines out where kids can potentially get to them? And remember, they might keep their medicines in a purse or a bag or a coat pocket, especially if they're not used to having kids around. They haven't had to go to this webinar. They haven't spent an hour learning to take care of their medicine safely, and they're just going along their usual business where children might not get into their medicine. Same thing happens if people come to visit your house, especially the grandparents. You want to ask, by the way, we have a special place for the medicine. Let me show you where it is. Do you have any that's left in your suitcase? Can I help you put it away? Can I get it out of your purse? Do you have any in your coat? Remember, the suitcases are often on the floor, and what does the kid love? Grandma's bringing presents, right? She's going to bring presents. So the kid's going to fish around in that suitcase looking for the presents, and you don't want those presents to be the heart medicine or the seizure medicine. That is not going to be a good thing. So, reading labels. The medication label looks like the most boring thing in the world, right? You'd probably rather read anything but a medication label, but there is a lot of really important information on those labels. So we're going to take some of the mystery out of label reading today and talk about what you might find if you go ahead and read it. And honestly, when you get the medicine, this is something that you really ought to be doing, looking at these labels. So first of all, look at the package. See that this medicine is safely packaged. See if the package has any clues as to how you're supposed to get it. Look at the ingredients. Like I said, you'll see the bold letters that tell you if it's got an antihistamine, a decongestant, a cough suppressant, something for mucus, something for pain or fever. But then you can look at the little letters too, and it'll tell you exactly what those medicines are. Look at the ages. There will be recommended ages. Those ages are there for a reason. You don't want to say, well, I can give this to a 4-year-old and they can take a teaspoon, so I'm just going to give my 2-year-old a half a teaspoon, right? He's half as old as the 4-year-old. This makes sense. No, it says 4 and up for a reason on there. And just because it's labeled for a 4-year-old doesn't mean you can give half that much to a 2-year-old. Look at the drug facts. There's facts. These are not alternate facts. These are real facts. They were put there by the FDA for a reason, and they're really useful. They'll tell you how to store it, when it goes bad, what some of the side effects might be. These are things that are important. And then look at the chart. If there's a dosing chart on there, that's going to be awesome. Sometimes it says, ask your pediatrician. Do that. We do not mind being asked. We are all here for you. Your doctors are ready. We should have people in our office who can answer these calls and let you know what's going on or what the right dose is for your child. Other things to look at on this label: how often are you supposed to give the medicine? So some medicines might say that you give it 4 times a day, or they might say give it every 6 hours. That seems to be the same thing, right? But really, it's not exactly the same thing. Every 6 hours means you might need to wake your child up at night if they're still asleep. 4 times a day means you don't necessarily have to wake your child up, just try and spread them out during the waking hours. Some medicines, the timing is more important than others. Now, the ingredients piece here is really, really important because, like I said, of those hundreds of medicines on the shelf, most of them overlap. So one thing that we see is poisonings in young children with cough and cold medicines because parents will give one, and they say, they're still coughing, they still have a runny nose. That didn't work. I'll give this other one. And yet, in fact, in most cases, all of the ingredients or some of the ingredients are the same. So you just overdose. Same thing can happen with fever medicines. If you don't know what's in each one, you say, I gave a fever reducer, there's still a fever. I'm going to give this other fever reducer. I gave Advil. Well, now I'm going to give Motrin. Well, Advil and Motrin are the same thing. So you really want to read those ingredients and know what's in there. You also want to know how long you're supposed to give it for. So, for example, if we diagnose somebody with strep throat, most commonly we use amoxicillin, and you want to give it for 10 days. Kid feels better in 2 or 3 days, but that 10th day is important because strep throat can cause heart disease if you don't finish treating it for the full time period. So if it says 10 days, you want to give it for 10 days. In other cases, you may have a little extra in the bottle. Some bottles only come in certain sizes. Sometimes the pharmacist wants you to have enough that if you drop a little bit or some of it sticks to the inside of the bottle, you still got enough to give. So you may have enough in the bottle to go longer. You might have 12 days worth of medicine in a bottle you're supposed to give for 10. That doesn't mean that you need to give it for 12 days. You can stop after 10 days. So again, if you're unsure, give us a call. We are always perfectly happy to answer those questions for you. That's what we are here for. Your pharmacist can also help. If you say, well, my doctor's closed, I don't want to call, your pharmacy may be open. Call them, walk back in, make sure you know before you walk out. Even better, they slip a little piece of paper in the bag to tell you all this stuff, but just ask them. They love this. They love helping people. We're all in the helping business. Another thing to do is to check and recheck. Every time you pick that bottle up, we do this in hospitals. We'll do a confirmation, even sometimes with another person. Say, okay, it says every 12 hours. Has it been 12 hours? It says 1 pill. Am I giving 1 pill? This keeps us from making mistakes in our offices and in hospitals, and I would encourage you to take those habits that we use. I mean, we do this all day, every day, and these keep us from making mistakes. If you're up at midnight trying to give your child a medicine, it is a really good time to do that recheck and say, okay, it's 1 pill. It's been 12 hours. Now is the time to give the next pill. I'm looking at the right bottle because they're all little orange bottles. This is the one that I need. Okay, just give it that second check, double check, and that will keep you from making an error. It is careless errors that get us in trouble. It's not, being ignorant or, being mean. It's just that we're half asleep and we've been up for 2 nights straight, and there's a whole bunch of bottles in the cabinet, and suddenly we realize we took the wrong thing out of the wrong bottle. That double check is there to keep that from happening to you or your child. Dosing tools. This is really important. These are tools. We use them for a reason. The right amount of medicine is a really important thing to give. And we're very cautious now when we administer medicines to make sure that we're giving you a tool that you can use to know that you are giving the right dose of a medicine. So let's start with one of our favorite tools and our smallest little tool, the medicine dropper, or a syringe. Now, you'll often see markings along the side. Depending on how much you give, the markings may be different. There are some that go up to 60 milliliters. There are some that only hold 1 milliliter. So you want to make sure if you get a medicine that you know how many milliliters, and then look at that thing if it comes with a dropper or a syringe. And you can even ask the pharmacist or the doctor, just take out a Sharpie, get a little permanent marker, and confirm. Look, it says 5 milliliters. Is this the 5? Just put a little mark there. Or you can do it when you get home yourself. Okay, this is 5. It says 5 milliliters. I've double-checked. Doctors are moving away from using teaspoons as much because we find that milliliters are an easier, more accurate way to mark these things. But if your doctor has used teaspoons, you might know that 5 milliliters is 1 teaspoon, 15 milliliters is 1 tablespoon. Again, if you have any questions, your pharmacist or your doctor should know the answer to these things. These things are super accurate. So if you lose one, go out and get another one. The one thing to know, some of these things also come with a little cap on them to begin with. So look at it, turn it over, feel on it. If there's a cap at the end, pull that off before you use it. This seems another like a really simple no-brainer kind of thing. But again, it's the no-brainer things that cause accidents. It's because they're no-brainers that we forget to do them. And so that we need to be extra cautious about those things. If that cap falls off in your child's mouth, of course, it could be a choking hazard. There are also directions on the package. Look at them, look at those numbers, fill it to the correct line, and then a matter of how you're going to give the medicine. Any of us who have pets, right, have heard from the vet, well, just squirt it right to the back of the mouth so that your pet swallows that. I can't emphasize this enough. Kids are not pets. Some days they can seem like it, but kids are not pets. So we actually don't want to do that with kids because they can gag and choke and cough. Instead, you want to just find a space between the tongue and the side of the mouth and then encourage your child to swallow the medicine And then rinse that dropper out. Some of these medicines contain sugary substances that can gum up the dropper or the syringe, plug it up. So just a little warm running water is usually all you need to clean that thing up for the next use. What else can we use? Well, we can use a medicine cup. This one in the picture is marked with milliliters for you there, 5, 10, 15. If you've got an old one, I would encourage you to get a new one. That one may be in teaspoons and tablespoons. But usually you should get a fresh one with the medicine. And I would encourage you to use the medicine cup that came with the medicine. Sometimes they'll actually be shrink wrapped on top of the bottle. Just use that one. I've got a little drawer full of old medicine cups. But honestly, I recycle those every now and then because, you want to use the one that came with the bottle. How do you fill it? This is actually a trick. You want to hold it up to your eye, right? This is your desire. I want to just get it right up here and see. But when you're holding it in midair, you're probably not holding it quite level. So you might have it tipped one way or another. And depending on which way it's tipped, you might have it overfull or underfull. So rather than bringing your eye to the cup, bring the cup to your eye, put the cup down on a level surface. Put it on a kitchen counter, and then squat down and bring your eye to the cup. That way you can read straight across, make sure that it's level, and you don't overdose or underdose. Younger children should be seated. If you've got an older child, they can probably stand with this. But if you have a younger child, toddler, go ahead and sit them down for this. They may not be great at drinking from open cups in the first place. You might even put them in your lap so that you can support them and help them out and keep them safe and secure and happy. And just like with the syringe, you want to rinse it out so that there's no gummy residue in there for the next use. Just rinse it, let it dry, and you're good to go for next time. Dosing spoons. These are super cool. They're sort of a cross between a syringe and a cup. For a kid, you don't want to squirt something in their mouth. They can take it, but then you do want to give them a little bit of extra help. So you actually fill the base of this dosing spoon. It'll be hollow. It'll be marked, just like a syringe or a measuring cup. You can use all the same rules in terms of marking what the dose is. And then you can help your preschooler just sort of tip it right back into their mouth, or your older child. They should be good with, drinking easily from a spoon. So these are often children who are a little bit better with their motor skills, kids who can use a spoon on their own, kind of concept, familiar with the concept. So if you've got a 12-month-old, this probably isn't the best way to do it. But for a 3-year-old or a 4-year-old, they're probably like this a lot. Likewise, you want to look at the directions that come with the spoon. You want to fill it to the correct line. You want to make sure you've tipped it all the way back. And if you don't have one but you want one, your pharmacist probably has a big box of these behind the counter and can get you one. So while we're on the topic of spoons, it says 1 teaspoon. Why don't I just reach into my drawer and get a teaspoon, right? Yeah, well, a teaspoon to us means 5 milliliters. And teaspoons that you use to actually serve tea or coffee or ice cream or whatever come in lots of different sizes. The people who manufacture spoons aren't really, they don't really care if it's exactly 5 milliliters that fits in that spoon. So you really don't want to use your kitchen spoon out of your silverware drawer to give medicines with. You want to use one of the things we've talked about, cup, syringe, dropper, or medicine dosing spoon to measure your medicine. Because teaspoons, out of the drawer, they could be any different size. Talking about cough and cold medicines, this is something we said we were going to circle back to. And the problem with cough and cold medicines is that there's not a lot of evidence that they do what we want them to do. But they can include some ingredients that can be toxic in overdose, especially for small children. So under age 4, we really don't like them for anybody. It's not clear that the safety profile is adequate for children under age 4. From age 4 to 6, some doctors will recommend that you use it. That's fine if you're using it under their care. But generally, we like them for age 6 and over. And when I say like, I'm using that word loosely. For my own kids, if you ask me what I do, I'll give them a fever reducer or a pain medicine if they have pain or fever. I'll use honey for cough. I'll use saline for stuffy noses. I'll use a humidifier. But in my household, there are no cough and cold medicines. And there haven't been for a very, very long time. So ideally, under age 4, you're not using them. And it is hard because cough drives parents crazy. It drives kids crazy. It is the worst. It is a symptom that is just torturous, and you want to do something. But what we recommend in children over age 1 year, honey makes a great cough medicine. I'm not saying honey-flavored cough medicine. Just plain old honey made by bees is great. Now, under 1 year of age, there's concern with botulism. So you do not want to use honey for children under 1 year of age. Under 12 months, no honey. Some people have even reported botulism with corn syrup, so just hold off on that until they're 1 year old. But after a year, you can use that instead. And finally, as we said before, many cold medicines, cough medicines, have a bunch of ingredients in them, and in general, it's all the same stuff. So don't combine them. Don't mix them together. This is not a mix and match kind of thing. If you're going to use one, just stick with the one. Fever and pain medicine. These are also things that people use a lot of. What is our most common complaint? Well, cough is number one, but right after that, fever. Fever and pain are uncomfortable, and we try to help kids be comfortable. We don't like looking at them when they're uncomfortable. We want to make them feel better, and this is one way that we try to make them feel better. So there are really only two kinds that are sold for kids. Acetaminophen is best known by the brand name Tylenol. And it is useful for kids under age 6 months, but if you're going to use it in a child under age 3 months, do talk to your doctor, because if that child's got a fever, we really want to hear about it. Fever under age 3 months can be very concerning for us, so don't just reach for the Tylenol. Call the doctor's office first and say, hey, my child is under 3 months, they have a fever, what do you want me to do? Ibuprofen we can give starting at 6 months of age, but really don't like to give it under 6 months of age. And you'll notice when you buy these things, you often don't see a dosing guide under age 2. It'll say, talk to your doctor under age 2. And that's really because we want to dose by weight, not age. Kids under age 2, 1.5-year-olds can be very big. They can be very small. And so we're going to look at their most recent weight and calculate the right dose for them. I'll add here that some people tell you can alternate these. You should alternate these. There is a move away from alternating, and that is if your ER doc or your local pediatrician said alternate, that's fine. But there is some concern that in the middle of the night, you're given acetaminophen, ibuprofen, acetaminophen, ibuprofen, 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 and suddenly you overdosed because you just got off, and fever does not hurt kids. So we don't want to give a medicine that could be potentially toxic and overdose for a fever that is in and of itself generally not harmful. So what I tell my patients personally is pick the one that seems to work better, use the standard dosing schedule for that, and make your life simple. If you need to reach for the other one because kid's got something that's not getting better, you can, but I personally am not a big fan of the alternating schedule. Thinking about old medications. This is a really easy way to keep people safe. These things build up around the house. They collect. You don't want to throw it away. You paid so much money for it. It seems so valuable. It seems so useful, so I'm just going to hang on to it. And suddenly you open your medicine cabinet, and there's like a little army of little bottles in there for different stuff, different dates. Half of it's expired. Half of it's only got 2 pills left in there, or 1 milliliter left. Just get rid of these things. Make your life simple. You probably don't need it, and it's likely unsafe to give it. At this point, if it's still left in there, please, please, please do not give an old antibiotic because this seems like the thing that the kid had last time. Your pediatrician will roll her eyes at you. She will sigh heavily and go, no, you didn't. Please tell me you didn't do that. Just get rid of it when you finish your 10-day course or 5-day course or whatever the course was. Get rid of any excess that's left. Now, we know we're not supposed to flush them because if we do, we will be attacked by mutant 3-headed fish. It will get into the water system, and actually you can test water systems, and there are amounts of pharmaceuticals in water systems. These can be difficult for the treatment plants. So what you'll often see is alerts from hospitals, pharmacies, your local waste collection. People will often have special days, community drop-offs, where you can bring all of your medications, drop them off safely. If that's inconvenient for you, if you don't live in a community where that's an easy thing to do, then here comes this kitty litter, very useful not just for your cat, but also for absorbing more than just cat pee, old medicines. Kitty litter will tend to bind it and absorb it, and you can wrap that up in kitty litter. Old coffee grounds work. We drink a lot of coffee in our house, so we usually have coffee grounds around. You can seal that in a plastic bag, and that will be buried probably in your community's landfill for thousands of years, and should not leach into the groundwater that way. If your community has an incinerator, of course, that stuff's all going to get burned up. Do remove the labels from these things before you do it. But you want to get rid of these things quickly, as soon as the medicine has done what it was supposed to do, and you want to get rid of it safely for your community. We try and do this a couple of times a year. Ironically, as a doctor, I don't keep a lot of medicine around. So, I don't like having it. What to do in an emergency? We want to talk about medication emergencies. If we had planned them, they wouldn't be emergencies. They happen to anybody. I tell people we wouldn't call it an accident if we had thought it was going to happen. That's what the word accident means. Fortunately, we have some things that we can do if accidents do occur. And the first big question you have is, who do I need to call? Do I need 911, or do I need the poison helpline, the local poison control center? Let's start with the Poison Control Center. Get ready to get a screenshot. Pull your cell phones out. Get your sticky notes ready. This phone number works wherever you live to connect you to your local poison helpline. 1-800-222-1222. That's 1-800-222-1222 to get help with poisonings, household poisonings. I have recently gotten the privilege of meeting a couple of doctors who run these things. They are some really brilliant and dedicated people. I cannot tell you how much I learned talking with these folks. They can find out anything you need to know, even if it's not a medication, even if it's a leaf off of a tree. A kid got a hold of a house plant or a piece of plastic or something from a toy. They will answer those questions for you as well. These people are so tremendously helpful. So keep this number where you can find it, given that it's a very difficult number to memorize, 800-222-1222. You can absolutely call them and get advice. They're there for you 24 hours a day and happy to help you. Now, there are some things that you want to skip poison control and just call 911 and get EMS out to your house or talk to them and get walked through it. So, not for poison control. Your child has lost or is losing consciousness. That is a super bad emergency. Please call 911 and get somebody out there. If you cannot wake your child up when she or he should be woken up, when you're trying really hard, you need EMS. Child's turning blue, never okay. Really not a good thing. If they can't breathe, again, that's an EMS question. If they can't swallow, they've got their hands to their throat, they're drooling, they have a panicked look on their face, that's an EMS moment. 911, even easier to remember than, what was it, 800-222-1222. Swelling of the lips, tongue, face, drooling, these things are all frightening. That's a 911 moment. Seizures, 911. Hives spreading rapidly all over the body, 911. Can't talk, not walking normally, stumbling around, quickly worsening, or honestly, if you're just not sure, 911 can always tell you to call poison control, right? Go with the emergency first. On the other hand, great reasons to call poison control. Oops, I gave the medicine to the wrong child. They're both on medicine. This was the wrong one for the wrong child. Is this okay? What do I need to do? Great reason to call poison control. Likewise, it can go the other way. You can give the right child the wrong medicine, and again, you're like, oh, this is grandma's heart medicine. I don't know if this is okay or not. This is my seizure medicine. Oh, man, is this going to be all right? Poison control will have the answer for you. They know the medicines. They know the tolerances. They'll probably ask you about your child's weight, what other medicines he or she is on. They'll walk you through all of it. Wrong dose. Oops, I just gave a teaspoon, then I forgot, or I didn't tell my husband. He came by and gave another teaspoon, thought he was doing a great thing, but unfortunately now it's twice as much. Is that okay? Great thing to call poison control about. If the medicine's given by the wrong route or you didn't do it right, call them, ask them. Or if it's given at the wrong time. Oh, man, it's supposed to be every 6 hours. I gave it every 3 hours. Is that okay? I waited too long. Is that okay? They will know the answers to these things. A final note about poison control and poisonings in general, accidental ingestions we call them. We used to have this stuff called ipecac. It was a horrendous herbal thing that made people vomit. And the thought was, oh no, first thing you want to do if a child swallows something they shouldn't swallow, you want them to spit it back up. It makes all the sense in the world, right? This is why we did it. However, it turned out, like a lot of things that make sense on the surface, not to be a very good idea. Why? Well, number one, even when a child vomits forcefully, they don't get everything out of their stomach. Second of all, this stuff, they can choke and gag and inhale whatever they're vomiting up. So if you have ipecac, put it in the kitty litter, put it in the coffee grounds, get rid of it. Finally, let's review what we talked about today. Number one, we said know your drug facts, read the labels. 2, put things up and away, locked, out of a child's reach. 3, back to reading labels. I'm big on that. 4, dosing tools, not your kitchen spoon. Use the thing that came with the medicine. 5, cough and cold medicines, not really for kids under age 4, ideally not much under age 6, and please don't combine them. Special medicine, fever and pain meds, again, there's really only 2 of them, so be careful you're not double dosing those. 7, get rid of your old medicines. We talked about how to do it. And 8, if you have an accident or an emergency, call 911 if it's a bad thing, and call poison control if it's you're not sure yet that it's a bad thing. All right.
Great. Thank you, Dr. Hill, for all that great information. We do have a little bit of time now for some questions and answers, and if you have not already done so, please use the chat window to send some questions to Dr. Hill. He will try to respond to as many questions as he can, although due to time constraints, we may not have time to answer all of your questions. And while Dr. Hill is looking over at these great questions that are coming in, I just wanted to remind you that you are invited to register on healthychildren.org. When you do so, you receive our free e-newsletter that comes to you twice a month. You have an opportunity to personalize your home page to get information for the ages of your children and learn about some special offers. In addition, don't forget to follow us on Facebook, Twitter, and Pinterest. And we hope you enjoyed today's webinar. We are going to see if Dr. Hill is ready for the questions. I do want to remind you that after we are finished here, there will be a quick survey that will come into your email inbox. Please take a minute to let us know what you thought of today's webinar. And Dr. Hill, are you ready with any questions?
I am so ready. And before I answer questions, I just want to make sure, because everybody's going to hang up and I might be in mid-sentence at that time, but I do want to thank our sponsor, Johnson & Johnson, Consumers Products Incorporated. They were very helpful in making all this happen, so thanks to them. I got a few questions that I think are absolutely fantastic. So we won't hit every question we got, but we got a few that can be really helpful. Number one question, going by weight, could you give a child under age 4 an over-the-counter cough medicine? My answer to that is we'd prefer not, really. And again, coming back to the following. Do they work, right? When I'm going to give a medicine as a doctor, my first question is, does this stuff do what I want it to do? And really, there's never been any evidence that they do. So A, I know we're desperate to make cough feel better, but there's not a lot of evidence that the medicine, I know it says cough medicine on the bottle, but they've never really shown that they do what you want. And the younger the child is, the higher the risk of overdose and toxicity. So especially under age 2, those risks are quite high. Under age 4, the risks are lower, but they're still there. So I ask myself, am I going to give something that doesn't really do much that may be toxic? And my answer to that is always no. Why would I do that? So my advice is ideally no. Number 2 question, when my child has an upset stomach, what dosage of antacids can I give? And, this is a little bit of a trick question, because even as a doctor, figuring out why a child's stomach is bothering him or her is really tricky. A lot of the belly pain that I see in kids is actually from constipation. Some of it is from a viral illness. They might have diarrhea and vomiting, or they're about to. The stomach pain that I see in kids is rarely from stomach acid. It can happen. You can get kids with reflux Usually they have other symptoms of reflux. And when I treat it as a doctor, I usually skip over the over-the-counter antacids, and I go straight, well, these are over-the-counter, but I'm really looking at ranitidine, which is Zantac. I'm looking at famotidine, which is Pepcid, or I'm looking at the what we call the proton pump inhibitors, such as Prevacid or Omeprazole, which is Prilosec, and drugs in that class. And then I might vary my dosing based on the child's weight or the severity of the symptoms. So my short answer is I'd probably skip the over-the-counter antacids. This was not in the slideshow, by the way, but if you're going to give Pepto-Bismol, there is a children's Pepto-Bismol that does not include aspirin. The adult Pepto-Bismol that you might have for yourself has subsalicylate, which is actually an aspirin variant, and that whole Reye syndrome, no aspirin thing kicks in there. So be sure if you are reaching for the pink stuff that it's not the adult version, because that's just like aspirin. That's a little known tip. There's a life hack for you, but no adult Pepto-Bismol for your kids. Another fantastic question. I get this one all the time. I'm so glad it's in here. Family history of penicillin. What happens if the doc prescribes it? That is totally okay, because an individual allergy like that is not heritable. Children do not inherit a single drug allergy. They can inherit a tendency toward allergies in general. Up to 10% of the population has been diagnosed with a penicillin allergy. Many of those are misdiagnoses. Penicillins can cause a little fine bumpy rash that's not really an allergy. When they cause hives, they are an allergy, and we do put in the chart, please don't give penicillin again. However, here's the nice news. For most kids getting it orally, even if they do have a real hivey, urticarial allergy, they'll get that again. But it's not likely to be life-threatening. If they get it as an IV infusion and they already had penicillin allergy, that can lead to a much scarier reaction. So just a family history of penicillin allergy, it's okay. Your kid can take amoxicillin. They will still have the same 10% risk of a reaction that anybody else does. It's not like I can promise they'll never have a reaction, but their risk of reaction is about the same as the rest of the population. Wonderful questions all. Another great one. What about mom's gummy vitamins? They're not candy. All gummy vitamins, right? Whatever you have them in the house for. Younger children. I actually, tell a story on myself. I have a distinct medicine of taking my mother's iron pills. And iron poisoning is actually one of the nastiest ingestions that we see. Iron poisoning is bad. I didn't take enough to end up in the hospital. But they were little and red, and they looked exactly like the little sweet hots that you use, to top cookies and cupcakes and stuff with. And I remember popping them out of the little blister pack and eating one or two of them. You cannot count on a child to know these things. So this is where the up, locked, and away is really important. It's hard to overdose on vitamins, but if you eat a whole bottle of them, you can. So I would get them up and out of the way, even though because they look tasty. People who live in states with edible forms of marijuana, THC edibles, this is a huge problem. In places like Colorado or Washington State, people keep their gummies around, and kids end up in the ER, hallucinating, hospitalized, ICU, because, hey, it's candy, it's a cookie, it's a cupcake. This is what kids love to eat. So I will say also, if you live in one of those states where those products are legal, those need to go up, away, locked away, just like the medications. They can be quite toxic and overdose. And, hey, kids love them. They're sweet. I'm going to try and hit one more in the next 30 seconds. Difference between what ibuprofen and acetaminophen treat. Actually, one more important. Should you have Benadryl on hand for anaphylaxis? Never a bad idea, but you're going to want an EpiPen as well, so call EMS if you don't have one. Finally, ibuprofen has an anti-inflammatory effect. Acetaminophen has a pain-relieving effect, but does not treat inflammation. Thank you all for being here, and please keep in touch through healthychildren.org.